really scared me because I didn't know this was a possible symptom of perimenopause.
I've had patients who had chronic back pain or hip pain. They've seen every therapist under the sun. We get in to do a pelvic exam, and it's coming from
loving myself more and letting go of things that are no longer serving me, although not every day. I'm really, really happy you all are here tonight. This is really new for me. I put myself out there because I wanted to gather women together and have community and conversation without all the noise. And I figured, what a better place and a better topic than menopause. We've all gone through it, or are going through it, or are getting ready to go through it. And there's a lot of information out there about it. And, you know, for me, listening to a 30-something-year-old influencer tell me I need to drink a certain drink to not have a hot flash, I want to kick her and you know what? Because she doesn't know. She's just making money off the things she's selling. So I know that our doctors know what they know, but I think it's also limited. And so, and talking to girlfriends is sometimes the better way to get information.
Yeah.
Whether it's real or not, we at least can have that conversation. So if you have a hot flash, you can walk outside. I won't be offended. If you need a minute, it's totally fine. There's tissues, I'm sure, somewhere. So anyway, that's kind of why I wanted to do this. And I'm so fucking grateful that you guys are all here. So thank you. I have these amazing women next to me, Jody McLean, who is a somatic therapist, but what is the right way? Is that right? Is that
Somatic educator.
Somatic, thank you. Somatic educator.
I like the so magic.
Really great word. I'm like so magic. Yes, absolutely.
So magic.
So magic educator. Yeah, educator. Yes. And then Candace Garrett, who is a occupational therapist and a pelvic floor therapist. So I've worked with both of these women, and they're amazing. So I wanted to share with everybody. So, and I wanted this to be kind of, you know, not clinical, right? I want it to be soft and nurturing and loving and real. And so I apologize if you're offended by my cussing. I'm really fucking sorry. My husband was like, maybe don't drop the F-bombs as much tonight. And I was like, oh. So sorry.
I think that makes it more real. So I like it.
Thank you.
Sorry, not sorry.
Okay, that's okay. You have to sit upstairs.
And then
Just kidding.
we want to mention the photos and videos.
Yeah. So we are going to videotape this and take some photos so I can show off and be better than the influencers. And so we're gonna videotape it those so I can put it on YouTube so those that aren't able to make it can watch it and learn. And so if anybody is uncomfortable with that, please let me know. I won't see your hand go up, but Maria or Alec will make sure not to videotape you guys. But I think we're just gonna focus on us. And then, you know, if you get in a photo, let me know if you don't want to be photographed. But you're all beautiful, and I would love to have you in any photos that I post. So, okay, so I'm gonna start with you. Okay, if that's okay. Is that okay? Yes. Okay, she's with us. So, Jody, I wanted you here because I knew you had some insight, and we worked together, and you've helped me tremendously. And so I wanted you to speak on what you feel you should with this topic in our living room series.
In my own experience.
In your own, yes.
Okay. Is anyone timing? Because you know, like,
I can time.
That would be amazing.
you know, just to give it up.
Yeah.
So then if there's not a
Sure. What is the time?
What time is it right now?
It's 6:45.
Okay, so I think like 15 minutes. Yeah, we can do that. Perfect.
First, it's so lovely just to look around and see all the different women that are gathering here. Yeah. A little dark over there.
Come into the light.
So Jamie asked me, and she asked me about this. She said it was going to be having a conversation, and I called. We're sitting here this evening, calling it the Living Room Series, a place to gather as women and share about experiences, but also a place to be able to ask questions. What I'm really loving is the range of ages that I see here. Yeah, some young women, some women that may be moms or in their mid-30s and 40s, and some women a little older. Yeah. So I'm 65. I've been 15 years now menopausal, and there's been so many transitions from when I started perimenopause at 43 to when I stopped bleeding at the age of 50. So it was a 7-year span for me. It started a little earlier, but the thing I think I want to share the most is when I started perimenopause, I didn't have a lot of resources of people to have conversations with and understand what my body was going through. So I think that's one of the things that I love about this evening is the possibility of having exposure to each other, but also resources, practitioners, coaches, naturopaths, body workers, herbalists. What do I want to say about? I think I'll start from being where I am now. When I 65 and having this 15 years, there is a transition, or was a transition for me from having a cycle and bleeding to finishing that, and there was some significant grief around that transition. And at that time, I had a really lovely group of women that we could do ceremony and ritual around that transition. It happens for some people when they are out of childbearing years as well. But then this remarkable, after the grieving process happened, this remarkable thing of dropping into my body in a way that having all the estrogen and progesterone, and well, mostly the estrogen, didn't allow me to drop down. It was a pretty significant dropping into myself. And also a freedom of, I'm going to use your F-bombs. I really stopped giving a fuck about a lot of different things that I had a lot more preconceived ideas about how I should be or how I should move through the world. And so gratitude for that. Yeah. But I did share a story with Jamie, and I'm going to share it with you because I think for how many of you are in perimenopause? Okay. So how many of you are in menopause? Have menopause for more than a couple years? Recent? Two, okay. And for those that didn't raise a hand, you're still asymptomatic.
Post.
You're post. Okay.
Post.
Okay. Oh, wow. So interesting. Okay. You postmenopausal?
Me?
Yeah.
Yeah.
Okay.
Yeah. Just direct me. Took it away.
Okay.
What's the difference?
Of what?
Of being in menopause or postmenopausal?
Well, if you go by a book, there's a whole year. I think it's a whole year.
In a day.
In a day after your last cycle, after your last bleeding, and then you're postmenopausal.
Oh, got it. Okay.
For like 7 to 10 years. So they say.
Yeah. Okay.
I thought it was more symptomatic. I didn't realize it was only based on bleeding. Because you could have no uterus and not bleed and still have hormones. Being like,
Right,
so
right.
maybe I had a misunderstanding. So when you were asking the question, like, I don't have a uterus.
Yeah.
Since I was 26. So
Yeah.
I haven't bled forever. But would you say I'm perimenopause or menopause? I wouldn't say I'm post because I'm still fluctuating. Does that make sense?
Yeah, yeah,
And
yeah.
So I
Yeah.
thought that the definition that you're asking me, how I'm responding to that question is based on the fluctuations. I don't know about anybody else. So
No, it's a really good point. No, no, it's a
I
good
wasn't
point.
sure the reference point of the definition, of like what you're looking to ask, maybe.
Yeah, no, that's a really, because I didn't even, like, in my awareness, I didn't consider, okay, 26 years old, you've had a hysterectomy, what is actually menopause at that point for you? It's a really good question, and I don't have that answer. Yeah, super good question. So you still have hormonal fluctuations?
Absolutely, it freaking sucks. Because I can't tell when I'm having a cycle. And
Right,
especially now that it's changing even more,
right.
there's no cycle. Where it used to have a cycle, and I would be like, woo, super depressed, watch sugar, everything like that, and then come back up. Where there was like a week where I could tell. Now it's like, oh, fucked. Since we're using the F-bomb.
Yeah.
I'm being honest.
And what kind of support do you get? Like, how do you work with those fluctuations?
I had very loving boys in my family, so my husband and my boys all know, so I'll call it a low day or a high day.
Okay.
And I go hiking with my other girls, or I'll call and I'll say, damn, that was a hard day today, or I need, I know that I've got girls around here, or, like you just have a bad day, and you can just look at them and be like, dude. But that's really, and then I take hormones and I stay physically active and I eat well so that those all help support those things to try to help balance. And I eat gluten free because I found that is also something that would mess with my hormones and my cycling and like all sorts of random things. Like you guys have probably tried everything under the moon, like, right? You just like you're like your own experiment. You're your own experiment,
Yeah.
and everyone's different from one person to another, so you just gotta.
Yeah. Yeah, I really appreciate, say your name again?
I'm Nicole.
Nicole. Oh,
Yes, that one. You under her.
we met
Yes,
at the art thing.
yes.
Okay. Yeah, you're bringing up a really beautiful, because I don't have that experience of having a hysterectomy and having the fluctuations like that at a young age and having to not have a cycle that you can depend on, right? Yeah, yeah. And I really appreciate that. Thank you.
I feel like I'm like the complete opposite.
Say,
I started really early, probably around 40. And didn't know it for a couple of years, just, I didn't take my pill. So, then the period never came. And I'm like, oh, okay. But then I just got back on it. And then, I don't know, like 6 months, maybe to a year later, it happened again. Like I went on vacation or something. And then it didn't come. So then I went to the doctor. And she's like, oh yeah, you're premenopausal. Probably have been for a little while now. I got only the hot flashes at night.
Yeah.
Yep. A couple times. That was it. And I just thought, oh, I sleep really hot. And those couple of times, I just slept really, really hot. Like soaking wet hot. And then I just never got my period again. I didn't have any grief over it. I was happy about it. I've been lucky I don't have like mood changes. I'm not on hormones. The bad part for me is hair loss. And what was my other one? I have hair loss. Oh, and just cry at anything. Happy things, bad things, doesn't matter. Those are like my two things. Because, I listen to friends that I have going through and they're like, I'm having a hot flash or the mood swings like she mentioned. And I'm like, I just have hair loss. I might go bald, but. And so, as I haven't like, tried to like get hormone therapy, I just had this conversation yesterday with someone who like, yeah, you should, because it's just good for your system and stuff like that. So I don't know, maybe I'll look into it.
Mm. Yeah, all the things that happen or can happen as we go through transitions. Hair
Stuff
loss.
maybe happening like inside that I'm not feeling,
Yeah,
you know, with my bones or whatever.
yeah, that's right. But also not even knowing at the time, oh, I'm just hot right now. There's so many transitions that happen or can't happen. How do we understand that it's part of the hormonal fluctuation? Where do we get the information and the resources so that we can better educate ourselves? So we have options about what it is we can do to support our systems. Yeah. Yeah. Thank you. Yeah. Hard to lose hair. I have hair loss.
Yeah, it's weird. Because my hairstylist too. But so far I can cover it, you know, or hide it a little bit, because it's just thinning, just literally around my hair. Everything else, it seems to be normal.
Yeah. Right.
So, yeah. Maybe I need to get on the hormones to get that back.
I don't know if it helps, because I was a lot of hair. Yeah, I don't know.
Minoxidil, actually, prescription strength.
Yeah.
Well, the spray is minoxidil. So it's actually a blood pressure medication. And if you take it in low doses, it helps the circulation and it helps the hair growth. So a lot of the stuff that's out on the market is like sprays you can put on your hair, but you can actually go to your dermatologist and get a prescription. And they give you like, if you had a blood pressure issue, you take like 30 milligrams, you take 5. And it takes about 6 months, and it's proven. I mean, my dermatologist said I'd be bald if I didn't start taking it 25 years ago.
Okay.
And he said that. And he still has a decent head of hair with like a receding hairline. But hands down, like even my hair person says, everyone that goes on it sees incredible results. So
I actually just about, we're not even in 2 months. My doctor did prescribe me some hair loss pills. They're not minoxidil though. It's something else.
yeah,
Because
you want to just get straight minoxidil. And let me just tell you, if you bump up to 5, because I started at 2.5, don't take them at night. Because you'll feel like you're having a heart attack.
Oh, no.
It's like, well, because it gets
Blood
blood
pressure.
pressure. It's just like, right. So you take it during the day. It's totally safe. I mean, talk to your doctor about it, but I have no problem taking it. I've lost half of my hair. Wow. In the last 10 years.
Yeah.
I actually also went into menopause when I was 42 after my second child.
Mm.
And I found out because I went to my doctor and I said, I feel like I want to rip everyone's face. What's going on? So she said, let's run your blood, let's take your blood work, whatever. So I basically had all I had was testosterone.
Yeah.
So I was just raging.
Yeah.
And I had no other symptoms, you know, because I mean, I was 41, 42.
It's young.
And I was still getting my period and all of that. And then I went on hormones. And, you know, to say back in the day, I'm 63. So this was a long time ago. And hormones were kind of like really looked down on.
Yeah.
And
They were fringy.
And like, no, you shouldn't do that. And I was like, you know, I lived at Esalen and the whole big sort of thing. I wasn't supposed to get like an amnio because my baby was going to, like, it's crazy, right? So I was like, what do I do? And she's like, you're going to go on hormones. Like, what's the problem, right? And I just went off my hormones because I started to get some breakthrough bleeding. And I was terrified. I was like, I love my hormones. I love my hormones. But it's fine, actually. I went off of them because I'm totally through menopause. I mean, it's over. I have no symptoms.
Congratulations.
Yeah. Hormones, and it didn't, you know, change anything. I was like, oh, I'm gonna, you know, shrivel up and die or something. That's a great. I could have, you know, sometimes you can't take them, right? If you get cancer or anything, you have to be careful. So that's my menopausal story.
If I can jump in, my mother died of uterine cancer, and she's spotting and bleeding after menopause. If anyone starts bleeding after official menopause, run to your doctor.
100%. They told me, like, get off the hormones immediately.
Yeah,
Really? If you have cancer, it just feeds on it. So
And if
you're
you
on
catch it
menopause,
early,
you're
it's
on
fine, but if you
hormones.
catch it late,
get off. I'm so sorry.
Yeah, too. Her doctors didn't listen to her. Like, oh, just, spice of life, sometimes you bleed, sometimes you don't.
Oh, gosh.
And it wasn't until she got to an oncologist, she said, no, that's classic uterine cancer signs. And it was too late.
That's the Gilbert Radner story.
Hers was ovarian, right?
Yeah, the same thing. She had symptoms and she went all over the world trying to figure out what was wrong. And the whole time by the time they found it, it was too late.
That's the thing that bugs me about our women's health, is no one fucking listens. How many doctors have we gone to? And they're like, oh, just suck it up, or you're being emotional, or it's fine, or, like, I'm tired of being dismissed by the traditional, even some of the naturopathic doctors. Any male doctor, honestly. I'm sick of being fucking dismissed. Yeah.
I only go to female gynecologists. I would not go to a male gynecologist.
Yeah.
I only go to a female. I mean, they understand the body, our bodies. So,
I think on the topic of the hormones, that's one of the stories I wanted to share with you. Like there's some beauty on being able to have the choice to put something in your body that, in a natural way, that may support an issue or multiple issues that you're having. And I went on them because I was standing I shared this with you. I was standing at the stove making granola.
No, I know, it was granola. God, it was granola, I want some.
And in the skillet is this concoction of all this goodness that you have to bring to like a bubble, and then the dry goods are over here. And I'm standing at the stove, dry goods are here, and the cast iron skillet's here, and I'm stirring it, and then you have to let it bubble, and I'm looking at it, and I'm watching it, and it gets to a certain bubble, and that's when you shut it off, and then you mix it all together. And I wasn't clear I was in menopause, like in perimenopause, but at that moment, I saw the bubbling started to happen, and I couldn't make the connection in my brain to shut it off. Like I just watched it bubble. I mean, fucking molasses and maple syrup and sticky goo just bubble over on the stove, and then all of a sudden my brain clicked in and said, "Shut it off." And I was like, "What the fuck just happened? What just happened? The fuck?" It really scared me because I didn't know this was a possible symptom of perimenopause, where the brain fog, where things don't connect. It took me a while, and it took me going through multiple, I'm very natural path, holistic medicine. It took me a while, but I finally found somebody that could help me with bioidentical hormones, and I did them until I made it through after 2 years of not bleeding, and I'm really glad I did. And I'm actually considering going back on because I've been diagnosed with osteoporosis. And there's a lot of studies that show it can, taking it the way I did is the biggest benefit you're going to get. And there's also studies that show it's still beneficial even at 65. And so the options of hormones or herbs, I think somebody that brought a sample of different herbs to try.
Yeah.
But
You
I
have a
did
tincture.
little tinctures, but I did herbs for quite a while before I decided on the bioidentical, because the herbs took me so far. But I got all that information from other women who were either going through it or older, or researching. There's a woman named Susan Weed. She's the grandmother of herbology, and she's really has some lovely books out on menopause and perimenopause and postmenopause. But also Dr. Christian Northrup. She actually is an MD, but she has a very holistic approach, and her books really helped give me guidance on which directions and which, which paths that I could, and go the roads I could go down to support myself. Yeah.
I love that.
So time check, just so you know,
Time.
7:06.
Okay, perfect.
Just keeping you on track.
And I really appreciate the kind of the popcorn, just like coming and adding in your bits of information like that. That's my, I love just bringing that in as popcorn style.
Let's keep
I think,
popping.
I think something that I'm scared of, like entering, like perimenopause, menopause, is all the things I've read about like anxiety and depression.
Mhm.
I have a long history of depression, and so I'm concerned about how all of the changes in my hormones, like, am I gonna end up going through another major depressive episode? Like, what can I do at that point? Like, do I have to up like medication, or is my doctor gonna be like, oh, you're fine, or whatever, So I think for me, that's kind of looming at the back of my mind, because I don't know what's gonna happen. I'm like, okay, like,
You haven't been here yet.
no, but like I've had 2 kids. I've had postpartum depression with both of them, pretty severe too. And so I'm like, okay, is this gonna happen again? And then I have to crawl out through it again. So I don't quite know what to do besides, I guess, just figure it out as it comes.
And connecting with other women. Connecting, staying connected, right? Staying connected. We are a we are a village. We didn't do things alone, and being able to have other people to connect with as a resource, so that you don't do something alone, have to do something alone, right? Because somebody can hook you up to something else, and I have this person, or I work with this person, and or somebody that can just sit and be with you as you're going through some darkness. Right?
I will share my number with you. I did postpartum depression, and I get depression every month.
Oh my
That was
gosh.
that cyclical depression.
Okay, gotcha.
See,
Yeah.
like right there.
I'm with you, girl.
Okay, yeah.
I got you.
Thank you.
Just because I'll understand.
I got you too.
Having the ability to have somebody who can say that to you.
Yeah.
And, like, I remember standing in front of the closet and crying. For
Yeah.
no reason, like my brain was saying, there's nothing wrong, you're totally fine.
I know.
Like
Exactly.
being like so out of control.
Like I'm thinking about all this and I'm starting to cry because I'm like, well,
course.
I'm not going to do it at home with my 2 kids and my husband. So
No,
You can do it
we
here.
get it. We get it.
thank you.
We get it. You're not alone. Oh my gosh.
I'd love to know how many of us have had conversations beyond just one-on-one about menopause, like beyond just your girlfriend, like in a group setting. I've never had a conversation about menopause in a group setting like this. It's like
I
the
talk to my
first
clients, I
time
talk
I've
to my
ever,
friends, but yeah.
ever done, which is like super powerful.
Yeah.
Right.
I haven't either.
I think it's, the fact that we're starting this, and my daughter's right here. She gets to listen to this. This is my mother.
no.
My mom had a hysterectomy, so she didn't really have the traditional menopausal symptoms, or at least she'd never shared that she had any of that. So she didn't pass any of that down. So like I felt like I was going through it blindly, and I had it very late. I started perimenopause after 50. So it just hit me, and I was like, okay, what does this mean? Did my own research and talked to a couple girlfriends and tried to figure it out. But not to have a community that for whatever reason, I feel like my mom's generation, our parents' generation, it's a little bit taboo to talk about. It's like, right? Not to talk, share that. Right? That's true. Yeah, that's very true.
They didn't even call it menopause, going through the change.
The change, right? Right. And
Statement.
it just, when you look back at all the symptoms of, so many women getting divorced at
Yeah, exactly.
that age of the change, it's like, oh, no, that totally makes sense. They're tired of the shit. But we never talked about it. And so to have this opportunity and hear all these different stories other than just reading, because I've read a lot about it, but to actually have,
Yeah.
people tell their real life stories, I think is extremely important. We need to do more of this.
Yeah.
I think this is, really powerful.
I have to say, when I went through mine, even though I had before I had my hysterectomy, I would have to have a fan on me 24/7. I'm like, why do I have to sleep with a fan when it's 50 degrees outside? I don't understand. But I didn't know what was happening. I think I even talked to my doctor and he was like, oh, you're fine. No perimenopause talk, no nothing. And only when I had and I would freak out, I was bloaty, I was super bloated, and I would eat crap because that's all I wanted, my sugar fiend. And when I had to get the hysterectomy, it was because I had a fibroid and some polyps. And they were like, the doctor was like, well, just get it out. You're fine. And I was like, I have my babies.
Yeah.
That's why I'm taking it. But then I was like, well, if it's cancerous, I don't want it. So, and again, I joke that I can wear white pants. I mean, it's a real thing, you guys. But it's also, sorry, it's a real thing. I'm not joking. Like, I have fear of getting blood on my white pants when I wear them. But I also, I didn't understand. I mean, mind you, when I had the hysterectomy, there was no real follow-up. It was like, okay, you need this patch, hormone therapy. I still had ovaries, but there was no conversation, really. Here's a pamphlet. I'm like, okay. And then I lost my sight. It's like, I can't even read the pamphlet. So, and I, unfortunately, as some of you guys know, had when my eyesight was going, I also had a vaginal fistula from diverticulitis that I didn't realize I had it. I called my doctor and said, I think I'm breakthrough bleeding. And he was like, that's impossible. I'm like, I know, right? But I wasn't. It was unfortunately fecal matter, but it's, it wasn't he said, here, take these antibiotics and it should be fine. No, come in, let's check it out. So to your point, Francie, they're, having conversations with other women and female doctors and male doctors. Like, I wish that they understood, and maybe some do. There's probably some out there, but I think we're all kind of navigating this together. And our generation, the Gen X, the millennial, whoever, women in general, doesn't matter what generation you are, we're all talking. And I don't think, like you, to your point, we weren't talking before. My aunt was a nurse in 1977, and they had just introduced PMS as a condition in 1977 in nursing school. So I'm so grateful that we all get to have this conversation with each other. And I love these comments. It's pretty rad. So, do you have anything else? You can still speak.
I like that it's a conversation.
Yeah.
Yeah. But you have this other woman.
I do. I know. I want you guys to get to know Candace.
Yeah.
So my other beautiful gal here is Candace Garrick, and she, like I said before, she works as a occupational therapist and pelvic floor therapist. Is that correct? Yes. Okay. Pelvic floor therapist. Yeah. Thank you. And before I asked her to come here, I wanted to understand it. And so I went to have an appointment with her session. Is it called a session or a? Either, yeah, an appointment. We had a meeting. We had a meeting. Because, and mainly for me, it was because I had C-sections for all my kids. So I didn't have the peeing my pants issue until recently. And then I was like, why am I tinkling a little in my underwear? I don't understand. And then my hips have been really tight. I mean, mind you, I don't go walking and all the things all the time, but still. So we had a really nice visit and I learned a lot about myself. And so I want you to speak to what you do and kind of how you navigate this menopause, even though you're going through it, right? The peri.
Yeah.
Yeah. Which I appreciated, by the way. Because she had a hot flash. She's
She's like, hold on, I gotta put my hair up.
I was like, I love you.
Yeah, since you disclosed that you came in as a patient, Jamie came in and
Oh, sorry.
she I don't remember if it was before or after the pelvic exam, but like,
I love, that was fun.
and then at one point she just was like, and I'm here to ask you to talk, to come talk about this perimenopause thing, menopause event that I'm doing. And it couldn't have been more timely because a couple of weeks prior, I had been seeing double out of just my right eye. I was at work. I asked one of the other therapists to please do a stroke assessment on me, and she was like, dude, get out of here and go to the ER. Like, what are you doing? But I had, you know,
Full schedule.
what are we thinking? I had a full schedule, and that therapist actually pointed out to me, and I think it was so true. She was like, what is it about us that needs permission to take care of ourselves? Like, you knew what you needed to do, but you needed somebody else to tell you that it's okay to cancel your schedule because they think you're having a stroke. So, I just turned 45, by the way. So this is a couple weeks before that, or maybe a month, and I was sitting in my clinic. I'm talking to a patient, I'm like, okay, double, not double, double. And I go to the ER, they do a full neuro workup, they do a full, very thorough workup of my eye, nothing wrong with either. And I told, I ran into a nurse friend who was a previous patient of mine there, and I said to her, if you tell me this is perimenopause, I'm gonna tell you to fuck off.
Oh my God.
What actually happened was one of our admins found a research article that, in fact, was related to an abrupt drop in your hormone drop during a certain stage in your cycle that results in double vision in one eye. Wow. And then it was resolved within 24 hours, and then it came back the next month, about the same time of my cycle.
Wow.
So one of you was talking about being your own
Experiment.
medical experiment.
Yes.
So yeah, so now what it does is it causes dry eye, even though it didn't feel dry. So now every morning I'm like, tell my husband, excuse me, I put my old lady dry on. And it's funny, like the fiber and the like magnesium and the eye drops and all the other kinds of things that like building my own personal pharmacy that's happening.
Yeah.
It's just this year, it seems like. But I want to talk a little bit about so many of the things that you guys have talked about have been, it's what I see in the clinic every day. We treat men and women, and we treat women across the lifespan. And it starts so early. It starts with pregnancy, that we're told that just because you had a C-section means that you don't have pelvic floor problems, which is not true.
It's not true, I know.
You still carried a baby for all that time. It doesn't, how it came out of you is important, but there's still things that need to be looked at. I have patients that have been told it's normal to, oh, I just had a baby, I just pee myself now. That's the way it is. Or they have a lot of pelvic pressure and they're told, oh, that's just the way it is now. Or it's normal. I kid you not. It's normal to have a grade 2 bladder prolapse after having 3 kids. No. It's not normal. It might be common. It might be things that we see common in the clinic or in the OB's office, but that is not a normal thing. And I think that there's a lot of shame and there is miseducation culturally that, oh, you know what, do your Kegels. Right, and then everything will be better. Oh, you mom. Right?
She didn't like that word.
It's like male
back here. Yeah.
It was named for a man, by the way. Kegels were named for Dr. Kegel.
Of course.
Yeah, that's why we hate
They don't work. They don't work. If Kegels worked, then we wouldn't have.
As I'm sitting here
every
doing
time.
that.
Right.
She said she was pelvic floor. I was like, oh God, I could have do my Kegels.
You can stop.
Yeah,
You don't ever
thank
have
you.
to do them again.
I don't ever
They
have
don't
to
work.
do them.
So I think that a lot of my patients, they come in, they sit down, it's the first time that they feel heard. And sometimes it's the first time that they really had some of their symptoms really be seen. I had a patient who went to the doctor because she was feeling heaviness. She was a nurse. After having her baby, they did the exam with the speculum, looked at her uterus, nothing there. She came in, she's like, something is falling out. And yeah, so when at Pelvic Health, we don't use a speculum, it's a manual and visual sometimes exam, and she had bladder prolapse. So what was happening was that speculum just pushed it out of the way. They looked at the uterus, they never even saw it. But I do want to say that pelvic floor therapy is very holistic. It's much bigger than Kegels, and we don't teach those, and we give people permission to just strike them off their list. This is Kyle. This is Kyle, our practice owner and also fellow therapist. So it's the first time that people are being seen and treated many times in a very holistic way. We're looking at your stress levels. We're looking at your relationship stress, sleep, diet, nutrition. Are you on HRT? Can we make some recommendations for vaginal estrogen? And then looking at the way that you're breathing, moving, and living in your body. And also toileting. Lots of talk about toileting.
We didn't talk about that.
I probably asked if you were constipated.
Oh, yeah.
Yeah, I did. But one of the things that I see a lot, and men do it too, but primarily women, and primarily women of my generation and above, like my mother, my grandmother's generation, is that there's a deep connection between your diaphragm and the way that you breathe, your abdomen and your pelvic floor. And when that becomes disrupted, typically because we've been told since the time we are young to suck in our stomachs, then we end up with all kinds of pelvic floor problems. And so what I mean by pelvic floor problems is stress incontinence. You leak when you cough or laugh or do a jumping jack, sneeze, right? Urge incontinence. You pee when you're almost to the bathroom. You got to go so bad and you leak because you're trying to get your pants down. Things like chronic constipation, feeling like you can't empty either urine or bowels, pain with sex, heaviness. Am I missing anything?
Oh,
The list goes on.
yeah.
But one of the things that I see so often is this flared rib cage from sucking in the stomach all the time, and a host of pelvic floor problems, and giving women permission to just like let it go. Like, what would happen if you just let it go and take a deep breath, and we can actually retrain your system to work the way that it should. So I feel very strongly about the work that I do. I'm very passionate about the people that I get to work with, and it makes me really happy. My favorite kind of conversation is like, I feel like we're wrapping up here. I feel like we're good and we're moving towards graduation, and getting to see, I might get a little teary-eyed actually. Getting to see people go out the door is always bittersweet, because I feel like I'm always, from day one, planning on breaking up with them. And I'm always happy for them, but a little sad for me.
Yeah.
But yeah, so that's a little bit about me and what I do, and my trip to the ER for not a stroke.
But that's important because I've never heard of that.
I have not either.
I also found out that you can have a hot flash just in like a localized spot. So I was getting this hot flash in my earlobe, just the right one, just right here, which is also apparently perimenopause.
Wow.
Learn something new every day.
I know, right?
Yeah.
I think you were talking to me about the anxiety or the rage.
Yeah.
And I was like, I think I told you last time I saw you, I was like, I left that appointment, I was like, I don't feel anxiety or rage. And then I was walking the dog with my husband, and he just wouldn't stop talking, and I was like, oh, there it is.
You're like, oh, what else? Yeah.
So how can we work with you?
I
I want all of that.
I was gonna give you guys a couple of takeaways, things that you can do starting today. One is let go of your tummy. Just take a big breath. Take a big breath. Let your belly be free. Drink more fluids, especially if you're having urinary symptoms. The first thing that people do, and they don't do it on purpose, is that they're afraid of leaking or they're afraid of running to the bathroom, and then they start to cut down on their fluids. The problem with that is if you're cutting back your fluids, now you might be irritating the bladder even further. I had this toileting posture, elevating your feet above your hips so that you can fully release. It relaxes the pelvic floor.
So squatty
Squatty potty.
Squatty potties are
Although
I was gonna say, we're anti-squatty
We're
potty
anti-squatty
now because the owner of Squatty Potty has been accused of sexual allegations.
Oh,
damn it.
So not the squatty potty, something like a
Just go
squatty
for
potty.
like an Amazon do.
Yeah.
Unless you're not doing Amazon, then make your own. Have a really cute lumberjack guy make you a Squatty Potty.
Where's the lumberjack guy?
Because isn't there like, because I've heard also that, how we all hover, because you're pushing, and so then you're just pushing your bladder out too. Like you're teaching your body to put it out or let it out. So I've heard that, and like peeing in the shower, because there are different muscles. So if you can hold it in the shower and not pee in the shower, right? Or are these
So-
some things that are
So elevating the feet with the squatty potty helps to relax the pelvic floor, right? And that's what makes you both urine and bowel easier to release. When you're hovering, you're not able to fully release your pelvic floor. And so you're trying to go through a tight pelvic floor. The same thing when you're bearing down a lot and you're pushing and you're power peeing or you're trying to rush that bowel movement out, you're actually probably contracting your pelvic floor trying to go against a closed door. In the shower, why are we training ourselves to relax our pelvic floor when we're standing? Right? That's the problem with peeing in the shower. It's not auto magical that you're like, you pee once in the shower, now you're ruined. But it's like you're training your pelvic floor to relax when you're standing, when there should be some tone in your pelvic floor when you're standing. Does that make sense? Yeah.
all these little things that you don't know every day that you do to yourself that just exasperate.
What I think is so interesting is my understanding from some of the reading that I've been doing recently, or there was a course I took, but I can't remember if it's Terry Hama, is that this amazing therapist is that we don't typically see these problems in younger people, women especially, men don't get incontinence in the same way, generally speaking, but there's something that changes, be it hormonally or childbirth or a trauma of some kind or menopause. There's something that changes that disrupts that what should be an automatic thing, your pelvic floor engaging or relaxing when it needs to. And so there isn't an exact science on why, but I think we can all identify we've been through things that have changed us. It could be that our, well-meaning mother-in-law or whoever was like, hey, suck in your stomach. Then you decided to suck in your stomach for the next 25 years, but something changed. The thing that's really nice about therapy is we can change it back. We can teach you how to do it. And it sometimes can be a struggle to wrap your head around, but we see it over and over and over again, success stories, right? I've never had anybody that we've been like, oh, she's a lost cause. So yeah. Any other questions?
I have a question.
Yeah.
I've had 3 bladder prolapse surgeries and a hysterectomy.
Mhm.
Is there benefit to pelvic floor therapy
Mhm.
still?
Yeah. Are you having symptoms? Do you mind sharing if you're having symptoms?
Oh, not anymore. The last surgery was, they actually tacked everything up to my tailbone,
Yeah.
was the last one.
Yeah.
So,
And you're
no,
not having your-
I'm good. It was a year ago.
Yeah.
But I just have always been curious if pelvic floor therapy would be beneficial.
Yeah.
I'm a little terrified of anything falling again.
I would say it depends on if you're having symptoms. Like if you're having symptoms of heaviness, leaking, urgency, those kinds of things, low back pain, then I would look into it. One of the reasons that surgery fails so often is because women don't usually get therapy before they do the surgery. So all of those habits that might be making their prolapse worse, if we don't address those before surgery, then you get the surgery and then we don't deal with any pressure control, then that's why you have some surgeries that fail.
Okay.
Does that make sense?
Mhm.
Yeah.
So is there a benefit to therapy after the surgery?
It depends on your symptoms.
Okay.
Yeah, like if
Okay,
you feel
got it.
good and you feel fine,
Okay. Thank you.
yeah, you're welcome.
I think you'd be surprised though what kind of tension is there. I've had 3 as well, almost 4, because I had to go back because I had rectocele and cystocele, both bladder and rectum, and they tried to fix one side and the other side ended up happening. But when they went in to do an exam, it was amazing how much, just like when you get a massage on your shoulders, you
Yeah.
don't realize how much tension that you're holding. And there's a lot of tension in there, and then a lot of scar tissue that also it can affect other things as well. So though you might not have symptoms, I think you might find it interesting to see how your body responds on the inside. Because how often do you go in and like finger yourself? Like, and there's a wand that goes in that releases some of the tissue around that area, and you actually, it looks like a long tampon, and you can do your own pelvic floor like massage, and by releasing those, you actually release like butt tension that then can go into your hamstrings, that can go into like all sorts of other things that you don't realize. It's like when you get your pedicure done or your feet massage, and then the rest of your back, you're like, oh God, I can feel it in my back, my shoulders, you just kind of relax. And I find that I have gone back in and pelvic floor, well, done it before and done it after. And I think, especially after surgery, when everything is like super tight and tension and then scar tissue and the healing, you might actually find that you might really like it.
Thank you.
And the attention, where I think there's a lot of trauma, and I think part of it was releasing some of the trauma.
Yeah.
So going back to even like what Jody was talking about, having somatic and like having movement and talking through the stuff, I don't know, Body Keeps Score kind of book, that if you guys have read that, like your body is holding on to that trauma of someone took an organ out of my body. Not only that, but then they went in and then like sewed me up and pulled me and moved all this stuff out and is trying to like fix me. And there's a lot of sadness in there that then comes up when I've been massaged and worked on in a pelvic floor kind of scenario. So surprisingly, did not have incontinence, did not have problems going to the bathroom, didn't have any of that, but had a lot of lower back pain that ended up, I was like, I know. They're like, I'm gonna do back surgery. I'm like, I'm not doing back surgery until I take care of my pelvic floor. And sure enough, it goes away.
Yep.
After the pelvic floor.
I think that's a really good point. Thank you for bringing that up, that some of the symptoms that my patients have are not urinary in particular. I've had patients who had chronic back pain or hip pain. They've seen every therapist under the sun. We get in to do a pelvic exam, and it's coming from this really problematic muscle called the obturator internus. A stubborn little motherfucker. But it's related to, your lower extremity mobility. And so what the legs are and aren't doing affect the pelvic floor. And that muscle in particular can refer pain anywhere. I've had it refer pain in patients to like hip, low back, groin area, tailbone. And so if you're having any symptoms around, this area, what I call like the neighbors, what lives next door to the pelvic floor, then I think it's worth looking at. And I will agree with you. Some of my patients that have had those, when I've had patients who've had those bladder surgeries or help me with this word,
Sacrococcalplexy.
thank you,
Oh,
which is a
Oh,
surgery that you
yeah,
had.
yeah.
Sacrococcalplexy.
Muscleplexy.
I always want to add.
Sounds like a
another-
cocktail.
Totally.
It's not a yummy one.
No, is that there, but just by the nature of how they pull everything together, there is a lot of tension across the pelvic floor muscles. And the one, sometimes it can be asymmetrical, like the left side of the pelvic floor is totally fine, and then the right side of the pelvic floor is like an ice cream cone going back towards the sacrum. So there can be a lot of different changes. So thank you for bringing that up.
So would your kind of therapy like help all this coming up? My mom has been having a lot of these symptoms,
Mm-hmm.
these lower back. She's always had been backed up and had to take something to release, like it's a lot of her life.
Uh-huh.
But she's been through back surgery and all these things. So she did think it was in her hip, and now the doctor's like, no, it's not. It's in your back. So now, just today, we went to a pain management, and I'm like, maybe it's this, because she does have the like, oh my God, if I don't get to the bathroom right now. I have that too, though, sometimes. But that's really my only symptom. But she's got like all these symptoms. She's 77. So is that something that might help her?
Yeah, yeah. And remember, like, we treat the whole person, so not just like, this is, I think, somebody was talking about doctors and medical
you and I
system,
were.
and looking at people like, with their magnifying glass and like, oh, you're a hip, you're a heart, you're a kidney. And so looking at like the spine is absolutely attached to the pelvic floor. What lives above the pelvic floor, all of this. What lives below it, all of this. So it's all relevant. But yeah, I think she would benefit from some pelvic floor therapy.
I would totally recommend Candace. She's actually my pelvic floor physician. I think I probably started having symptoms after my second kid, and I was like 32, and now I'm 38. And so it took me like 6 years to kind of get over the shame of being in my 30s and leaking. And I'm going, okay, I should probably do something about this. So yeah, and so now I see Candace, and hopefully I'm almost to graduate soon. I'm so close. There ends up being something stressful in my life, and then something kind of sets me back, but I'm getting there. I'm totally getting there. And so, yeah, I think for me, looking back, like, yeah, I wish I had done it earlier. Like, I wish I didn't wait 6 years, because I was like, oh, I'm young. This shouldn't be happening to me. I don't want to admit to it, It's like, and I do feel like a difference, which is like crazy, because I'm like I can actually like sit upright, like, because like my core was really weak, my pelvic floor too. And so like I can feel a difference in like the way that my body is carrying itself too.
Yeah, good.
So, yeah.
At 55, I feel like I'm too young for the little mishaps. I'm like, why am I going through this? And my mom is going through this. I'm like,
Companion.
I'll be fine if I'm going through it at 77, but not at 55.
Well, I'll share that I'm 34 and have been diagnosed with a cystocele. Never had kids.
I've never had kids either.
Never had kids. I was a heavy weightlifter. I played collegiate volleyball. I was like Division I athlete, right? Like super strong, and still have a cystocele, still have prolapse. So it comes for everyone. And I've had some moments of stress urinary incontinence. I remember it was an urge moment. I was sitting at an Old Navy. I was in grad school. I was in grad school. And I was at Old Navy. It was a long ass line. And I'm like, oh, I gotta go. Let me just get these clothes, and then I'll go to the bathroom. And for whatever reason, I put my card in a little like thing, and it didn't read it right, and it declined. And as soon as it said decline, I just peed everywhere. And I was like, thank God I bought pants. Thank God these are black pants. But I was in my 20s. I was in my 20s. And that a couple of years later was when I found out that I had the cystocele. So, and I'm over here. Candace is like, are you okay? Are you in pain? And I'm like, it's just my chronic hip pain. It's fine.
Bladder prolapse. Okay.
Yeah, cystocele is bladder prolapse.
Okay.
Yeah, but of course, leave it to the therapist to recognize when someone's uncomfortable. Yeah, but yeah, like you don't have to be perimenopausal, you don't have to be menopausal, you don't have to have kids. It comes for everyone.
So who would, like, I've heard that, pelvic floor therapy is good for women who have, and men, but women specifically, who have had a period, have had a period, had a child, had sex, or trauma. Is that correct? Okay.
I think, if there is a lot of value in prevention.
Yeah.
And so having these conversations about how, just like in perimenopause itself, but and menopause itself, those changes in the hormones is when we start to see problems that might have been there for a long time. As the tissues become less, by the way, I'm going to interrupt myself. I really have a problem with the verbiage that some of my patients come in with, what they've been told about their pelvic floors. I don't love the word vaginal dryness, but I'll tolerate it.
Atrophy.
Atrophy.
Oh, I hate that.
Vaginal
hate that.
atrophy.
Hate that.
You know that a man said
Oh,
that.
Yeah.
oh, it's so rude.
It's so rude.
So rude.
There's like
So rude.
geriatric pregnancies.
Yeah.
Yes.
But I digress. But those tissues really do change. Those tissues really do change when we go through perimenopause, menopause, and that's why we start to see some of those symptoms come around that time. Urinary symptoms, or you didn't have them before, bladder prolapse that you didn't know that you had before, but maybe now you're feeling it. Rectal prolapse that you maybe didn't know that you had, but now you're feeling it. And so, what did I get started on this topic for?
Just the vocabulary.
The vocabulary, the verbiage, but before that, we were talking about tissue changes and prevention. Just like we're talking about all these things here, if we were having more of those conversations with women and younger women before they are going through all these changes. And so we do things like birth prep and how to maybe try and avoid getting a bladder prolapse when you give birth, and postpartum care, trying to find those symptoms as soon as possible. And so I think you're absolutely right. Like, it benefits everyone.
Yeah. Right? But no one ever talks about it. I didn't know about you guys until.
Yeah.
And honestly, my idea, I think I mentioned to you, I thought if I went to see a pelvic floor therapist, you were going to make me hold Benoit balls in my to see how strong it was.
Has been debunked now.
It's supposed to be for fun, not for exercise.
Or are there like cones that you hold or whatever for strength? Yeah.
Those exist.
Yes.
I've never used them.
Okay.
Can the therapy help with UTIs prevention?
Absolutely. Oh, that's good.
That's a great one.
And UTI symptoms,
Yes.
where people have symptoms but they don't actually have an infection.
Guilty.
Yep.
And doesn't estrogen, vaginal estrogen also help with fertility?
100%.
Yes.
Which is why everyone should be on it.
Everybody should be on it.
It's actually for people who are in perimenopause and menopausal, it's the first line of defense. So like antibiotic, if they tested positive, then they get the antibiotic, but then after that, it's the first line of defense is vaginal estrogen.
Okay.
And we are like advocating for vaginal estrogen probably 13 times a day, all day long.
Really?
And there are still doctors out there that will decline my patients a prescription. And then I'm like, get it online. Just get online now. You don't need your doctor's permission. So
Yeah. But should you have a balance between estrogen and progesterone?
it's different because it's not oral.
Okay.
It
So-
stays more active. That's
okay.
like really important that people don't understand, right?
Yeah, it's great.
Is that it stays nice. It's not like taking a pill and it going all over your body. It stays. Yeah. That's like, hell no. Huh? Keep that substance moving down there.
Are there contraindications to vaginal estrogen? Like, are there reasons?
Just the history of cancer.
Okay.
Yeah, yeah, it's that blanket statement of HRT being bad for, causing cancer. That is the one thing is like history of cancer, then you probably don't want to be on it.
Specifically with like cervical, uterine, ovarian cancer,
Yeah.
active cancer, if they've removed said organs that were estrogen responsive, then there's some context in which they're comfortable with it. Recent research said that if you are in remission for breast cancer, vaginal estrogen is safe to use, which is new, like new.
And doctors don't know it because my sister had a breast cancer and they will not give her vaginal estrogen.
Yeah, a lot of oncologists are, understandably so, going to be very hyper conservative on who they give estrogen to because of that. But they just recently took the black box label off of vaginal estrogen, which is like one of the only things I'm proud of in the last couple of years when it comes to
I was gonna say the
Yeah.
FDA just changed that.
yeah,
rule
it's like one of
last
the few
year.
things I'm really proud of the FDA for doing
I know, right?
in the last few years. But yeah, because there was a really poorly done research study that said that vaginal estrogen was supposed to increase cardiovascular disease and cancer risks, and it was the wrong type of estrogen. And that's, that the type of estrogen that they use for vaginal estrogen now is not the same kind. And it was just a really poorly performed study. So yeah, there's been some really great pioneers in the field who have been able to lift that. But there's this gap of 20, 30 years of women who are going into perimenopause and menopause who are given the wrong information.
Yeah.
So it's really
And the doctors that aren't being educated on it for that whole time too.
yeah.
So I feel like I think we're in that zone where we're trying to find those doctors who are educated or want to know more about it and who will help you walk through, or even know like about the double vision or the plantar fasciitis. What the hell is that about? And then the shoulder, stiff shoulder and all that other crap that goes along with it.
Shingles. I got shingles from it. Dropping estrogen knocks out your immune system. I got shingles a month ago. And I looked it up. I'm like, yeah, thank you, menopause. Another gift from menopause.
See, I didn't know that either.
There you go.
Wow. That's pretty. What is our time, by the way?
You're at 7:47.
Oh, perfect. So I know we've asked a bunch of questions. Do you have anything else that's totally? No, I'm good. Well, you're out. Okay. This one too much. Just kidding. I do have the cards. I don't know if anybody has, if you even want to write a question down, because we've been asking questions this whole time, which I absolutely flipping love. So, but I want to give everybody a chance to either, because Jillian's going to do a sound bath for us, which I'm so excited. Is she in here?
I'm back here.
Okay.
Yeah, I'm back.
So we can have a little break. I mean, we don't have to sit here the whole time. I think this is kind of a flowy sitch. Everybody look at that. You can grab a little food if you want or a drink or use the bathroom. And then unless anybody has any other questions for me, for Jody, for Candace, or just for anyone in the room.
I just have a comment, because I'm thinking about this, and I'm wondering if the reason, like, we don't talk about these things and it feels so taboo, or did feel so taboo, is because as women, like, we're kind of taught to be perfect, and we feel like we have to always, like, to talk about menopause is to admit you're aging. And that feels like, at the core of it, that's just not pleasing to men and people don't. And yet, I mean, I wish we could flip that, because there's so much to embrace, as you said, about aging and about the stage of our lives. And yet we just are like, I don't want to talk about the fact that I have painful intercourse, or I have this, or I have that, all of these things. And no one's saying, hey, listen, this is how things are going to go, and not to be afraid of it, but to advocate and talk about it. And so, I mean, there are some good resources that I found out there that have been wonderful and educating, but I had to find them myself. Like, I had to dig and find it. And so I remember bringing it up at a book club once, and there was a woman there was like, we are not talking about menopause. And it was just like, oh my gosh, like, what? And she was younger than the rest of us, but later a couple people reached out to me and were like, I do want to talk about what you brought up. Book club, like, let's talk about it. Yeah. Let's just not talk about it with her. She doesn't. But it was like she was afraid to talk about it because it meant we're getting older.
Yeah.
Wow. Well, and it seems like there's a push just culturally away from real bodies and a lot of plastic surgery. And, I mean, literally fake people are being made famous, so It's like,
Non-aging, like I haven't yet, trying to
yeah,
reverse
well,
their
it's not
aging.
even real. I mean, there's AI movie stars now and rock, musicians. So it's like we have these bodies and they are limited, and there's this real feels like there's this tension between being real and being in our bodies and achieving some new tech bro reality where we're invincible, perfect, it's just, I feel it, especially, as I age and become more invisible in the world. And yet I feel like I've never had more impact as a person. It just seems really interesting to me to watch how judgmental people are about their own natural processes.
Self-deprecating.
Well, and it's learning how to embrace where we're at,
Exactly.
loving where we're at. Like, it's, I feel my belly in my hands all the time to myself, ugh, gross. But it's who I am, right? And I'm not pushing stuff down anymore than I was and getting myself sick. I'm loving myself more and letting go of things that are no longer serving me, although not every day. I'm gonna have moments, but I've had to shift. I mean, unfortunately, it happened because of what happened, right? Catastrophic event, but I think it happens to women every day. We're trying so desperately to love ourselves, and we're being told, well, but you don't look this way. You don't look that way. You're 56 years old. 40th high school reunion, that's forever, right? It's so long. You're so old. Even my kids are like, you're so old. I'm like, fuck you. They actually don't say that. But you know what I mean? Like there's, I think
your
it's
mind, you
in my mind, yeah. No, but I do think it's how you look at yourself, and you're all flipping beautiful.
Well, my friend just went to her doctor and she goes, so I guess I'm obese, apparently. That's what my doctor says.
Yeah.
She's like, yeah, you need to lose, however many pounds. She's a 12.
I'm a 12. Yeah.
I'm like, we need to change the standards. That's the average woman these days.
Yes.
So, like, I don't feel like technically that should be obese anymore. And she's like, she literally said after that, she's like, I think I look fine. I'm like, yeah, I think you do too.
Good for her.
Yeah.
Good for her.
I do. I think there's such old standards that they go, like nothing has been, not nothing. I feel like it hasn't been updated fast enough to come with the time. Like, as someone said, the women now at our age, whether you're 30 or 70, right? We are speaking up. We're saying, oh, hell no. I'm not gonna stand for you to tell me, Dr. Blah, 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 or man, or whoever, that I can't feel the way I'm feeling. You can suck it. Well, you know.
I was gonna say, I think to your point about having the conversations, and like I said, this is the first time I've ever in a group setting even talked about menopause. I think having this with our daughters is super important too. Like I could see this the next one being that next conversation, because I want my daughters to know before they get pregnant, like what the next cycle and chapter, and not be afraid of it, of the unknown. I want them to have access to
And what the support is available for that. Yeah.
Absolutely.
Yeah.
Yeah.
And for them to create their own community and
Yeah.
support of their own peers. And so thank you for doing this. And I think if we can change that, where we talk to our daughters and as in groups and communities, we can shift, the whole narrative of it's, we're not getting older, we're passing wisdom.
Yeah, that's
Like the whales, right?
Absolutely.
Yeah, the grandmother theory. I was thinking
Yeah.
about this whole time.
Yeah, the grandmother theory.
Yeah.
And the reason whales, female whales outlive male whales is because they're no longer useful. They're not passing down the wisdom and grandmothers do, right? They're the ones holding all the information. So we need to share it.
I'll add too that like maybe not necessarily in like a similar space, but like we need to be teaching our sons this too.
Oh, 100%.
Yes.
absolutely.
100%.
Absolutely.
We need to educate our sons as well.
And those damn husbands.
And the damn husband.
So I have a question about that. Like, how do you start that conversation without sounding like a weirdo to your 18-year-old? Like, hey, babe, you know, I know you're going to college and everything, but I just want you to know that, you know, whatever, girls are different. I don't
You
know.
know, I have a girlfriend who, she has PCOS. She has a 14-year-old son. She
Can you
did.
tell me what PCOS is?
Oh, gosh. I forgot what it
Polycystic ovarian syndrome.
Yeah.
Sorry.
No, thank you.
I'm Hermione Granger.
No,
Yeah. Anything women's health. Me.
And so like she and basically like yeah, her son knows very well when she's not having a good day. Oh, mom's on her period. Oh, it's like day 2 or something. Okay, let's leave mom alone. You know, and so she's been very just open and honest in that sense. And it's always been very science-based. It's like, well, so mom's uterus is doing this right now. That's why it hurts so bad. And so with that, yeah, it's interesting because I know she's told me that, yeah, like her son will go, oh, mom, are you going to start your period soon? And you know, she'll say yes or whatever. I'm sorry. Like, and so there's just a lot of like empathy for, you know,
compassion,
yeah. And so I think, I don't know, along that vein, yeah, just kind of I don't know,
Human.
Being open.
being human. Yeah.
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 Yeah. Especially the husbands.
The number of times we're like talking about a patient case or something like that, and then we're both just like, I think they just need to divorce their husband. Honestly,
Just change the ban.
I've had
Get rid of
former,
the ban.
I've had former patients like come to me like at a coffee shop. I remember this as clear as day. I was on a date with a man, regrettably. And she came to me, she had interstitial cystitis, which is a painful bladder syndrome.
Okay.
And I'd been working with her for a long time, and she came up to me. She's like, "Oh my God, Dr. Kyle, it's so good to see you. I just want to let you know that I'm feeling so much better." Turns out all I needed to do was leave my husband. And like, we were making progress in therapy, but you know, she was like, "That helped me so much." And
Oh my God.
she gave me a hug and she left. And the guy I was dating was like, "Does that happen often?" And I was like, "All the fucking time." All the time. Mhm.
Oh my God. Wow. Okay, so our time is,
8 o'clock.
okay, perfect. So on that, shall we take a little break?
Yeah.
And then people can, you know, we'll just stay seated for the sound bath.
Can I do my health advisory now in case anyone
Oh my God, yes.
says they probably shouldn't be here?
Yes.
Sorry, normally I have it at the door, but I was not thinking about it. Okay, hi, I'm Jillian. I'm a sound alchemist. I actually recognize quite a few faces in here from past sound baths. So just minor health advisory. If you are newly pregnant or at the end of a pregnancy, not a great place for you to be. If you have had a recent surgery that is still healing, including like a broken bone or a recent injury. If you have a history of seizures and are on anti-seizure medication, usually that's just for people who have like musicality seizures, but if you have complex untreated PTSD, I think that's all about it. Oh, sorry. Yeah, and if you have tendinitis in your ears, that might not be like
Tinnitus.
tinnitus. Thank you. Might
Or
not be
tendinitis.
tendinitis. Maybe not.
I'm like, wow, those are
Wow.
busy ears.
So those are all the health advisories. So if you're good, if you have questions, please come up and ask me.
Yeah. that's amazing.
Can I say one radical thing about menopause
Please.
before we break?
Yes.
I feel like we as women have been robbed of this like biological, physiological rites of passage that are available to us, and like starting with being shamed through our period and like not understanding the 4 weeks of our cycle. And I feel like menopause was also really taken from us in a similar way. And I like love the grandmother theory. Like we are one of, I think, 7 animals that have menopause. It's just us and like 5 whales. And so I feel like the men cannot handle the truth that comes out of our mouth as we age. And so this was taken from us. And like, of course, when we get together, we talk a lot about the symptoms and the hard part of it because we're so fucking unsupported. But I want to like circle back and remind us that like there is a biological, physiological need for wise women who have gone through this initiation. Oh my God, initiation. There we go, 4th time. And so I don't want you to forget how badass you are through all of this suffering and how much we need the wisdom of the elder women in our society and how like, we've lacked that wisdom, and that's why we're here. That's why we're in this place now. And I'm hoping like through this multi-generational awakening that we're going to turn the tide, because let's be real, the men fucking need us right now. All the women fucking need us. The earth needs us. And so like that sacred knowing that comes through these struggles, I think is like often overlooked. And I think it's so vital for a healthy society that we have these like crones, right? These wisdom holders as we get older. So just don't forget you're also a badass of all your suffering.
Well, so much better. Before I forget too, and before we break, Ferris and I put together these curated gift boxes for everybody. And in them, we have some Viva La Vulva, lube. We have some doTERRA roller from Heather Satava. That's a blend specifically for menopause, just to feel good. Yes.
Menopause empowerment.
Yes.
Yeah, and hormonal support.
Yes.
So if you have questions, I'm happy to answer.
We have some a tea bag in there from Urcura that's specifically, it's called Goddess Glow, and it's specifically for anyone maybe needing it while they're on their period or going through the transition through menopause, or just tastes good. You just want a nice cup of tea, and a few other things in there. So we curated them and made them for you guys, and I cannot thank you guys enough. I know we're gonna like do our sound bath, and I don't want to like have this after. I want to make sure you guys integrate. So that's why I'm saying it now. I'm so grateful. This was a huge gift for me, and I hope for you guys to have conversation with each other. And I hope we continue it, because I think it's important to continue talking. And everybody has my email, and I'm gonna put your contact information, if it's okay, and yours if it's okay, on my website. So, which is jamieestelroth.com. So, and we'll continue the conversation. And I love you all, beautiful bitches. I love you. I love you.